you want to talk about it, they're going to try and get us straight.
Good afternoon, everyone, and welcome to a special meeting of the Salisbury City Council on February 19, 2019. At this time, I would like to ask everyone to please silence any electronic devices or anything that makes noise. If during the meeting an emergency should arise, we please ask that you leave the chambers in an orderly fashion, make a right-hand turn, and go down the stairs. If for some reason that exit is blocked, please make a left-hand turn out of the chamber and a right-hand turn and go down the stairs. Please do not use the elevators if there is an emergency. If you need assistance, please ask, and we will be happy to provide it to you. Do not use, again, the elevators in case there's an emergency. At this time, I'll call for a moment of silent meditation. Thank you. Please rise now and join me in the Pledge of Allegiance to the flag. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I now entertain a motion to adopt the special meeting agenda as presented.
So moved.
Second.
Mr. Boda, Ms. Jackson. All those in favor, please signify by saying aye.
Aye.
And the chair votes aye. I'll entertain a motion to approve ordinance number 2525 for the second reading.
So moved.
Second.
Ms. Jackson, Mr. Ireton. Mr. Tillman, good afternoon.
Okay, this is an ordinance of the city approving an amendment of the FY 2019 general fund budget to appropriate funding for the costs of billing real property taxes. Whereas the county has notified the city that they will no longer bill city real property taxes, whereas the city has received estimates for cost, forms, postage, mailing services, personnel, software implementation, and software licenses of billing real property taxes totaling $85,000. And whereas the Finance Department requires that this ordinance hereby approve the addition of a cashier 1/2 position in order to fulfill the duties required for real property billing, and whereas the city's fiscal year 2019 budget does not contain an appropriation sufficient to cover the above required services and costs, now therefore be it ordained by the City Council of the City of Salisbury, Maryland, that the city's fiscal year 2019 general fund budget be and is hereby amended as follows. Increase current year surplus by $85,000 and increase the Finance Department by an equivalent amount.
Any questions or comments?
Just, it's unfortunate that we have to do this and not receive a service that we as county taxpayers in the city pay for. And literally, it only costs, other than, well, the postage doesn't cost it because they're sending the stuff out to taxpayers to begin with. So literally, the only cost that the county is saving on this is the ink on the paper. That's sad, that city taxpayers have to go and foot this bill, and it might even be a little bit more next year because this is just to get prepared for it this year. So, and this is an ongoing cost for city taxpayers.
I would echo Mr. Council Vice President Boda's. Salisbury taxpayers are also Wycomico County taxpayers, and that seems to be forgotten historically, forever, always. It's always been forgotten. Of the $1.3 to $1.8 million that the county owes us every year for duplication of services that I pay taxes for to the county that I get nothing for, here comes another bill. At some point, our residents of this city and the residents of the other small cities that are getting the same bills, because this is going to affect places like Del Mar and Willards and Fruitland much more than us, much more than us. Until we rise up and say that we need a county leader that's going to treat us as one people instead of a people to be pitted against one another, city dweller versus county dweller, or rural dweller versus city dweller. This is what we're gonna get. The idea that the Chamber of Commerce didn't stand up and say, this is what in the 70s we wanted the city and the county to do. We wanted you to combine these things so there wasn't duplication of services. We wanted you to do these things together. We wanted you in the same building. I'm not exactly sure how the city, with its 35,000 people, continue to be put into a crouched position, but we have to stop. I don't know whether or not in my particular tenure, I've stood in this room and watched the county executive say he was going to pay for fire services. And that didn't happen. And then it was negotiated away. And we all smiled because everybody was getting along. And now we'll all smile because nobody really wants to say anything cheap. Nobody wants to say anything about how far the fire trucks are going to have to go or the ambulances are going to have to go, that we have to pay for, that somebody else should be paying for. This is sad, and I'm going to vote no because it's a protest vote. And I would make a motion that we send this down the hallway and say be a leader, is what I would say we should do. But Mr. Council President, thank you for the time.
Any other comments? I do concur with my colleagues. It's sad. It's a sad time. But whatever goes around comes around. So, having said that, I will call the vote. All those in favor of ordinance number 2525 for the second reading, please signify by saying aye.
Aye.
Opposed?
Nay.
Nay.
And the chair votes aye. Thank you. Thank you, Mr. Tillman. Ms. Nichols, do we have any comment?
No, I have a question.
Yes.
Ms. Blake's vote, I didn't hear it, I'm sorry.
Nay.
Nay, okay, thank you.
I would, just so you know, we have nobody to do this in the city now. We have no way of getting
So
the
we won't be
taxpayer.
able to collect taxes
We won't
now.
be able to collect taxes, just so you know. Would anyone like to reconsider their vote?
I would ask respectfully that the administration go back down the hallway and negotiate a better settlement. That's what I would say. It's not our job. Our job is to do the money. And it seems as if every time we end up on the short end of the stick, the five of us are supposed to sit at the table and smile and go, this is the worst of the best situation we have, or this is the best of the worst situation that we have. And we're always the ones that are doing that.
I understand what you're saying,
Yeah.
but by the same token, this has cleared the work session. It's cleared the first reading, and now we are going to step up and make us
She had something to say.
yes.
So this has already been discussed?
Oh,
with
yeah,
the
it's in the work,
council?
in the
The
work
county
session.
council? Has it
Oh,
been-
yeah, well-
Did you take it back to them? Was it taken back to them and discussed at some point?
There was a negotiation that took place.
Yeah, if I may,
Go right ahead.
Please.
we have been down the hall numerous times, approached this from different channels, from different folks on either side of city and county administrations to try to get to a point where, well, hopefully they'd keep doing our taxes, but that it's not going to happen. I can tell you that, unfortunately. Keith and his team have been working diligently with Munis to put the software in place to be able to provide this service come, the summer. It's going to be tight as it is, but he's doing his best to get us where we need to be. This is going to put us in a very difficult spot.
I will change my vote, but I'm gonna tell you, this is sad. This is truly sad that we've come to this.
Nobody disagrees with you.
No,
But
I'm not
my
saying
point-
no.
My point is just that this is not gonna, a voting no is not gonna impact the county in any way, shape, or form.
No, it
The
won't.
only people that are gonna be impacted or our people?
Well, I guess I'm voting no, A, because I'm allowed, one, and two, because maybe somebody who's writing for the newspaper will write a story, because there's never a press release that comes out of this building that says that everything's wrong, and something is wrong, and this is wrong. I would respectfully ask my leader and my mayor to stand up and say out loud publicly, and all of the people who support him, and all of the people who stand with him in all his pictures, to do this, because there's not a vote that the mayor has to take. And I have been very clear with you all in the past that after, every once in a while we do reach our threshold of, oh, okay, because that's what we've done. So
I don't disagree
you have
with
3 now, so we're fine. It's nothing. There'll be nothing more said publicly about it now.
So at this juncture, what I understand is that it's been through the readings, you've already been down the street, you've already negotiated.
Well, negotiating means you get something.
Right.
We don't we say negotiating, Angela. What we actually mean is we go down there and they tell us what they're gonna do. And we look to see if anybody's gonna help us. And nobody helped us. It's probably not Jake's fault or anybody in the administration's fault, but we go down the hallway and we get told what it is we're going to do.
So at this session, we're not going to be able, do I understand, we're not going to be able to collect city taxes if we don't get this together at this point? Is that what I understand you to say?
It would
Just so I
be-
know
Yes,
historically.
it would be very difficult without that
Okay.
additional staff person to make it all happen. And this was a part of a larger negotiation, and this, on this point exactly, it was no, 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 which you'll hear in the second part of this meeting. And the county executive put out a press release today saying that we came to an agreement on many larger issues, the chiller, ESG, things like that. We were able to get some concessions there.
And again, my point is, you have every right to vote no, by the way, Mr. Ireton,
Thank you.
and I respect that. But by the same token, you voted aye, and you voted to move this out of work session, because normally what we would hash this out in the work session. And I would respect if that's what we could do from the future. Because this, if you just want to make a public comment, you can take the reporter outside and give her any public comment that you want. But as a council, we
Is
voted,
there a reporter here?
Yes.
yes, there is a reporter here.
Wow.
So I would suggest you speak with her afterwards and give her your opinion. We all said that we agreed the fact that this is not good. It's not acceptable to us. But by the same token, I'm not going to punish our people for something that they have no control over.
I would say that is a mischaracterization of what my vote is, Mr. Council President.
Except that the effect of that vote was going to be our inability in an orderly manner to send out tax bills and collect our tax bills.
Yeah, can I comment? Because I missed whatever happened, but may I weigh in on my thoughts on this situation?
Sure.
I don't know, again, I don't know what just happened. I was in a budget session, but it is, there was a press release that went out today, which is comical. You know, an elected representative of the voters of our county has taken it upon himself to do a disservice time and again to our citizens. It's mistreatment, it's borderline criminal. It's awful, and it's stunning. And yet, we're left with few options. They don't have to provide that service for us. They don't provide it for any other municipalities. We had a deal. We paid for it. We paid for it. We paid for that service. There was no gift. We paid more than it was worth, I think. And now we're in a position where, You know, they're not going to provide that service anymore. Out of what? I don't know. Spite? I'm not sure. But for no positive reason for the taxpayers. It does nothing good for anybody. It is just a bad deal, and it is just about one person's desire to, you know, win a petty match. It doesn't make any sense. There's nothing good about it, and you know, now we move on, and we got to provide the service to our citizens. You know, and that's the unfortunate thing about it. So that's my opinion, and it's just a shame. It's just a shame.
And we have total agreement that that's the
Yeah,
case.
I don't know. I don't know what was said. All I knew was, you know, it was more important that I be in here than in the budget session that I was in. So, but you know, and that's not the end of it. I mean, there's, you know, this is another failure, and another, I think, you know, representation of dysfunction in county government. Total dysfunction in county government. And this is just another example. Add this to the manipulation of fire agreements. Add this to, you know, I mean, years of failure to negotiate or unwillingness to negotiate on tax differential. The only county in the state of Maryland. You know, it's just stunning the way our taxpayers get treated by county government. So.
You get no argument from this group.
So, okay, well, then I'll get off my soapbox.
Will we take another vote? Are we going to
Well,
take another vote?
I'm gonna
Okay.
poll. We're gonna do we're gonna revote. So, if I could, April, vote yes or no, please?
Yes.
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 And the chair votes yes. So 4-1 is the vote. Thank you. Thought that was going to be short, easy. Do we have any comments?
Yes, sir.
Okay, hearing none, we will close the special meeting. Welcome to the work session for February 19th. We have a full agenda today, so we're going to get right into it. At this time, I'd like to have, who's doing this? Is Colonel here? Anybody from the police department here?
No cause for them?
No?
I can
Yeah.
speak to it.
Would you,
Just give me one second. I gotta pull it up one second.
actually, I just saw the chief down on, by the bank.
So there was a vehicle that was involved in a motor vehicle accident, and this is, looks like two vehicles, one due to flooding and one to an accident. And we're just then going to take those proceeds and purchase a new vehicle that is going to be an SUV, so it's a little bit more than the proceeds, than the insurance proceeds at $34,261.
So a question I would have, is there money in the budget for the balance, the difference?
Yes.
There is?
Yes.
Okay.
And this will be, by purchasing this vehicle, we're removing something from the CIP that was in this year's portion of it, so
okay.
it's helpful.
Okay. Do you know what that amount was, roughly?
That was way more expensive than what we're spending. The CID evidence,
Was that for a full auto?
it was like 48 at least.
It's in the 40s. Okay.
But this is going to serve that purpose?
Yes.
Okay,
At a cheaper cost.
okay.
Any other questions? Do we have consensus to move this forward?
Yes.
Yes. Okay. Chief Tull. And your guests. Cast of thousands.
Pack the house up there.
Wow.
They moved up here very swiftly. How's everybody?
Good, how are you?
Good. Good.
Good afternoon, thank you for this opportunity to be here. We would like to take a few minutes to provide an update on a remarkable program that is in place. And that is our SWIFT program, or our Salisbury Wacomico Integrated First Care Team. And have some guests with me today that are essential to this program. So first off is Ms. Kathy Fiddler. She's the Vice President of Population Health at PRMC. Next is Ms. Stephanie Elliott. She's the Director of Community Health Initiatives. You know who I am. And then Ms. Tammy Wolbert. She is the SWIFT nurse practitioner that works alongside firefighter paramedic David Fippen, who unfortunately could not be here tonight because he is actually in Baltimore at a conference dealing with more of the mobile integrated healthcare, community paramedicine, learning about some other initiatives that are happening throughout the state and nationwide. So before we really get into it, I'd like to take a few minutes to see a video. Some of you may have seen this video. It was the one that has recently been played on the Facebook, social media for the city. Hopefully it'll run.
A lot of folks use the ER when they don't really need to.
Excuse me. Oh my God.
SWIFT program, the Salisbury Wacomico Integrated First Care Team, is a way for patients to get in touch with the resources they need before they need to get to the ER.
It's a burden on the healthcare system in general, and there's plenty of resources out there that can help these people with some low acuity things like, less than urgent medical needs. There's urgent care, there's primary care, and things of that nature.
Not only are we cutting down the amount of times you call the ambulance, but it's cutting down the amount of time that you're in the hospital. So it frees those resources up to take care of somebody who might be a little bit more critically ill and getting the patients the care they need at the right time. Our program is unique in that it encompasses the hospital, health department, and emergency medical services.
The hospital has given us access to their population health staff from the Wagner Wellness Van. We use their nurse practitioner one day a week to do new home visits for some of our patients, and they let us use a registered nurse on one day a week to go out and do follow-up visits and help with things like that. I was a street paramedic for 20-some years, here in the city for 12. I know most of these people by name, just because I've carried them so many times on the ambulance. So it's kind of, I take this real personal. I get to know the people and care about them, and I think that's what makes the program work so well. I really do care about these people, and they're just not a number to me.
So just a great video that really shows a little bit about what the program is all about and how it truly is helping the community and the citizens that live within the Salisbury Fire District in our community.
Okay, so just a little background about mobile integrated health or community paramedicine. It was first mentioned in a 1996 article titled Emergency Medical Services Agenda for the Future. It was an unnamed concept. It was actually just part of a vision for the future of EMS, and it described what the emergency medical services of the future would look like. And according to the report, the future would be that the EMS would provide community-based health management. It will be fully integrated with the overall healthcare system. It will have the ability to identify and modify illness and injury risks, provide acute illness and injury care and follow-up, contribute to treatment of chronic conditions and community health monitoring. It will be developed from a redistribution of existing healthcare resources. It will be integrated with other healthcare providers and public health and public safety agencies, and it will improve community health and result in a more appropriate use of acute healthcare resources. Then in 2006, the Institute of Medicine of the National Academies published an article that said that EMS systems remain fragmented, and it continued to support the incorporation of integration of EMS into the overall healthcare system. But it described a vision of a 21st century emergency care and trauma system where 911 dispatchers, EMS personnel, medical providers, and others all interconnect and unite to ensure that each patient receives the most appropriate care at the optimal location with minimal delay. So fast forward to 2013, when the first such programs actually got off the ground. There probably were some pilots before that, but the first states to implement successful programs were Minnesota and Maine. And they did these in the rural areas because they had such a need for resources in those areas. And the concept of community paramedicine was to allow paramedics with specialized training, so they would give them training to serve as an extension of primary care in the rural communities. They did diabetes education, blood draws, wound care, surgical follow-ups, fall risks assessments, medication reconciliation, and a whole lot more. In the first 16 months, the Minnesota program saved over $58,000 on just one mental health patient. So the original intent was rural, but then an ER doc in San Diego took that model and they molded it into a program for the major metropolitan area of San Diego, where 0.04% of the population actually generated 5.4% of the 911 calls in San Diego. Actually, it obviously proved to be very cost effective, and then they developed several programs just in the San Diego area, one of them that saves over $700,000 a year. So there are now mobile integrated health or community paramedic programs in nearly every state. There are 9 programs in Maryland. Our own SWIFT program was the 5th, and we started in October 2017. Many different models throughout the U.S. We modeled ours after Queen Anne's County. Many variations in the regulations from state to state are some of the things that make us have to have different models. Texas, for example, is a delegated practice state, so there's no statewide scope of practice for EMS. What they do is actually determined by medical directors. So Texas is considered a national leader in mobile integrated health. Also, whether a program is rural or urban determines the model of the program. So rural areas obviously have less resources. Urban areas tend to have the resources, but they're not accessing them at all or not accessing them appropriately. So we talked about regulatory nuances being a major barrier, but another big challenge is funding. Minnesota, first state to pass legislation authorizing Medicaid reimbursement of EMS-based community paramedics. That was in 2012, just before they started their program in 2013. I don't know if other states have followed suit with that. I would imagine that they have, but they actually bill 80% of a physician assistant's office visit in 15-minute increments. They bill when they go out to see these folks and provide that care. However, it's not widely reimbursed throughout the U.S., so most of it is grant funded, partner funded, or some is wholly funded by one entity. The Center for Medicare and Medicaid just announced the Emergency Triage, Treat, and Transport, or the ET3 model. While it doesn't reimburse EMS providers directly, it will pay for care delivered at other places besides the ER, and it kind of allows the EMT to redirect care for a more appropriate location based on their assessment, and Kathy is going to talk more about that. How does SWIFT work? So our program is a mobile team aiming to deliver high-quality and cost-effective medical care by coordinating resources among Salisbury's EMS providers, PRMC, as well as many community partners. We use Salisbury firefighter paramedic David Pippin, as we mentioned, and Tammy is our nurse practitioner. We also use RNs, social workers, which have been a huge help, and the community health workers also are a huge help. They actually can go into the home and follow up after the initial visit. They do some of the follow-up visits. Wycomico County Health Department has provided input into our programmatic design, and they also manage the grant. Okay, where am I? Who is eligible? Individuals who call 911 at least 5 times over a 6-month period for non-life-threatening medical reasons. The patients are chosen from a list, and they are contacted, the program is explained to them, and their consent is obtained for participation. And we have had very few who have declined to participate in this program. The SWIFT team then conducts their home visit, the initial visit, again with the nurse practitioner and paramedic. They provide physical, mental health, and safety assessments. Safety assessments can be a physical condition of the home, lack of utilities, safety of the neighborhood, who are their neighbors, relationship dynamics within the family, and anything that would threaten the patient, and so forth. They screen for social determinants of health, which I will talk more about on the next slide. And based on their assessments, they refer patients to the appropriate care teams, such as their primary care physicians, medical specialists, in-home providers, our own community health workers and social workers, and community resources, such as financial counselors, social services, transportation resources, the MAC Center, Meals on Wheels, those types of things. Social determinants of health, economic status, demographic factors, education level, food availability, access to health care, et cetera, they significantly drive the impact of chronic disease and other clinical conditions. It's actually estimated that 80% of patient health is determined by social determinants and social factors. Okay, are you next?
So initially with the SWIFT program, we had to establish some goals. And one of the goals was to reduce the 911 use from what we would consider our high frequent flyers. And we had looked at, for the first year, being able to enroll at least 70 people into the program. Fortunately, we fell just a tad bit short of that, and we were able to get 60 members enrolled in that program. But with the social deterrent, with the health care and all that stuff that we just talked about, it's hard getting some of these people into the program and getting them all set up to go. But what we were able to achieve is the reduction in our 911 calls from these individuals. The goal originally was approximately a 20% reduction. We're at about a 40% reduction in those individuals who were repeated 911 callers. So huge difference in the ability to get these people to where they need to be instead of just calling 911. Again, it's about connecting people to their primary care, and the program has done exceptional with this. And when you look at the number of things and our referrals, to date, 105 referrals have happened. So the program has been able to get people the care they need at the right time. So when we look at that, we're talking about 25 referrals to allied health agencies, 10 to mental service agencies, 19 to social services, 10 to health departments. We've got 9 into PT programs. We have made 18 referrals and arrangements to have people with transportation just to get to a doctor's appointment. So instead of calling 911 to go see their primary care, we've been able to arrange taxi with taxi vouchers to get them to their primary care instead of the emergency room. And not only that, but 15 referrals for other things like home safety inspections, where people go in there and they look at their homes to make sure they're safe. You know, things that we would typically look at, smoke detectors, carbon monoxide detectors, but they go even farther to make sure, can they move around in their homes? Are they safe? Do they have the right medical equipment? This program has obtained hospital beds and deliver these hospital beds and set these beds up in their homes so they have a place to sleep instead of sleeping on a mattress on the floor. This program has taken motorized scooters and repaired them so that they now have a way of moving around. So it's so much more than just the day-to-day, hey, how are you doing? It's making sure that their welfare is taken care of. Wheelchair ramps. You know, the program has been phenomenal for those people. Those 60 people, it has been phenomenal in changing their lives. So when we start looking at the numbers specifically, we have been very fortunate. We have had good partners and able to attain some grant funding. To date, over $260,000 in grants have been given to this program. Care First was the initial startup grant where it funded us for 1 year for $95,000. Last year, we were able to get the Maryland Community Health Resource Commission grant of another $90,000. And just recently, Care First has awarded us an additional $75,000 for a 2-year period. So it shows that the programs work. These organizations would not contribute their funds to an organization if it wasn't successful. And I believe we've been able to demonstrate the success of this program.
So, I'm going to talk a little bit about the PRMC information, but first I think we need to go back to the very beginning of your entire council meeting where there was the conversation about lack of collaboration and lack of communication. And this partnership has been phenomenal. What the hospital, typically not probably the best partner in a community to help support community members where they live, work, and play versus in the hospital, is partnering in a phenomenal way. And it is because of the vision of Chief Tull and Mr. David Phippen. They came to us, they had an idea, and they said, can you help make this possible? And I can't stress enough how much it was their passion and persistence that made this all possible. The team that you're looking at here is just a small subset. I've listed the PRMC in-kind donation just to get a sense. It's about $100,000 in FTE costs that we're supplying, not including the work of Stephanie and her team and many of the community health workers that are going out and visiting these patients. But the knowledge of this program within our organization and within the community is very strong, despite the fact that it's 50 patients, because as the chief told you earlier, those 51 patients, you can see on the next page, called 911 over 399 times. There was one individual who had called 911 every single day of the month. There was 30 calls to 911. And so there's a variety of reasons, as Stephanie talked about, the social determinants of health, the things that impact us. But we are here to do things differently as partners, and it has been a very rewarding opportunity and showing real impact. So I can't stress enough what this collaboration and coordination between these two organizations has been. We've learned a lot about each other. I think for all of you, for your knowledge, the state of Maryland has changed the way hospitals get funded, and we now only get funded in reducing utilization. But it's unnecessary utilization, and I think we could all agree that somebody calling 911 30 times in a month is rather unnecessary. We might not understand why, but we've got to get to that point. So programs like this, we are very supportive of, and it's not going to happen. We're not the experts in so much of this. Stephanie did refer to that CMS opportunity that was just announced on Valentine's Day. I'm not quite sure what the meaning of that was, but CMS recognizes that we need to figure out a way to pay for these programs. So I'm hoping to come back to you in a couple months and say we want to do this with CMS, the Center for Medicare and Medicaid, and do this. The challenge in Salisbury is the county and the city work very differently. So if we could support the county, it would be a much bigger lift, but it would be a much bigger opportunity to change people's lives. But we will be continuing to pursue this, and that's the plan for our organization. Right now at our state legislature, there is talk about trying to figure out how to pay for these non-emergent visits, so these mobile integrated health units. It got tabled last session, but we're hopeful that this session that may come into play. It will require the commercial insurers and Medicare and Medicaid are able to pay for it. Medicare is generally willing to look at these sorts of things. So I just wanted to say that. But you can see the outcomes. So these are ED-only outcomes on this next slide. So before we met them, before these individuals, we met them, they had almost 400 calls. They were down to 377 after the first month. Afterwards, and you can see we've dropped them almost 150 calls overall. So savings about $58,000, nearly the salary of an EMT with all the expenses, but luckily we have had grant funding. So some really great outcomes. If you look at the next slide, these are the most current outcomes that we've seen. What we're able to do within the hospital because of the EMR that we use in our connection with the state of Maryland's CRISP, the Chesapeake Regional Information System for our patients, it's the Health Information Exchange. We can look at all their behavior for 1, 3, and 6 months prior to entering this program. And the day that they meet David Phippen and Tammy, then we can move forward. And as soon as we have enough rollout of activity, we can see what they've done. And you can see the first month, we reduced ED visits with these individuals by 60%. That's very impressive. 3 months, 16%. I think they start to get to know them, and then they're like, no, don't come, I'm going to get in trouble. I can just kind of see the behavior from the stories that they tell. But then they get them really connected in these communities, get them connected to primary care providers and many of the other services. 31% decrease. And then we're looking at 12 months. These numbers are very small for 12 months of full participation, so there's too much variability in that for us to be confident that 11, it's probably higher than that is my guess, because these guys, David said he never discharges anyone, so they always have his number and they can always get in contact with them. These next slides in the pretty colors of blue and orange are really just what that looks like from a cost of total charges to the hospital. We are a regulated state, so the charges are a little deceiving, but you can see we still are, in some ways, reducing the total cost of care for these individuals, but more essentially, those numbers of unnecessary visits to the ER and to the hospital. So any questions? Tammy's got some stories for you. Tammy's one of our nurse practitioners that sees the patients, but any questions you have about this program or anything that we're doing?
When you go out, how many people do you visit, like, in a day?
It depends. Some of the follow-ups that we do, usually the paramedic and I, the nurse practitioner, go out on the first visit because we have a lot of assessments that have to be done. And they're referred by the number of 911 calls. So the list that we get this week may have several people on it, and then next week, not so many. And then usually the following week, the nurse and the paramedic go back out to follow up with them.
Are most of these 911 calls necessary, or?
These are non-emergent.
They're not emergent.
I mean, people call for reasons like, I can't open my pill bottles, or
I can't get out of my
I
chair.
can't open my bottle of water to be able to take my pills. Can you help me with that? So it's all kinds of reasons.
One of the interesting outcomes, because now the fire department does know about this, the emergency services does know, is now there's automatic, rather the first call that's unnecessary, they're now calling back to Stephanie and her team to have a community health worker go out proactively before we even have to have this overutilization. So that one unnecessary call is now triggering a call to our community health team, so that they'll go and do outreach early.
Are these mostly seniors that have these issues, or there are variants of ages?
Various.
Varies. We do have a lot of seniors, though. It does vary.
I would say mostly seniors, but not all.
And to answer your question, or add some more to that, usually it's just Thursday that they go out and open new cases. So it's 1 to 2, I would say, a week, because it does take quite a while to do all those assessments.
I think to your point, having been a volunteer fireman for a few years, when the tones would go off, every department's got this issue. I don't care where it is. I will guarantee you they got it. And I can remember laying in bed at 1 o'clock in the morning, and it goes off, and the address comes over, goes, oh, Miss Ellie. And you get to know it, and it's sad. Personally, I think some people call because they're lonely.
Yes, exactly.
And all they want is somebody to talk to them, at least from my experience. And I'm not an EMT. I was a driver and a get this and get that. But this program, I think, is a prime example of what groups can do when they get together and they share their experiences and share a common goal, and as opposed to what we talked about before. And I hope that we get to a point where more companies, more fire companies can benefit from this. Because ultimately, it's not just for the benefit of in a cold manner, it saves wear and tear on the vehicles. It saves it's a safety concern, because you never know if it is a real emergency or not. So you're gonna get there, and that puts people at risk. So I think there's many, many benefits that are beyond the number of benefits, and I commend all of you for your work. Yes. I know what it's like, and you guys do a great job.
And not only the risk of responding to that call, but by not going to that call, that puts an emergency vehicle readily available for the next call, which is an emergency.
Right.
Because if not, you're taking that unit out of service for, 45 to 55 minutes, being tied up, not readily available to handle the next emergency. So, it's huge for us. I think we have a story, real quick, success story.
Yeah, just somehow this lady, and people get themselves into all sorts of situations. She moved here from South Carolina into one of our senior living apartments here in the city, and she has a multitude of health problems. She's a diabetic, she's had a stroke, she has high blood pressure. She moved into this apartment, she had no furniture. She had been here for a period of time and had run out of all of her medications. She had no primary care doctor. So she was calling 911 because she was out of her medicine, because the medicines that she had, she couldn't open them. You know, she was falling out of her wheelchair that was in poor repair. So a multitude of services got involved with her, from, being able to get her medications refilled so that she had them, to getting them blister packed so that she was able to get to them and take them when she was supposed to, the right medicines at the right time. We were able to get her a primary care provider and help her arrange transportation to get there. We worked with some other agencies to get her a wheelchair, to get her a cushion that kept her in her wheelchair, and to get her hooked up through her primary care to get a motorized scooter so that she was able to get around and get some socialization in and be able to have a better outcome with her life. We were able to get her Meals on Wheels through MAC. The community health workers were able to get her paperwork filled out for short transit so that she does have transportation to appointments, to the store, things like that. These people are chosen because of the number of their 911 calls, and this particular lady has not actually been into the emergency department since August.
Wow.
And some of these people that we get to know, that we go and see pretty often, if we don't see them and they don't hear from us for a couple of weeks, they call and check on us to see where we're at.
What happened to you? Are you okay?
Right, exactly. Where have you been?
So that's just one example
Yeah.
of the success of this program. So, any other questions for the program?
Just when you utilize mental health or make a referral of mental health, do you utilize mobile crisis?
We have used mobile crisis.
Okay, and then because they can access an appointment within a day. Okay. This is just the best of collaboration ever. This is the best program.
It's awesome.
We love it.
Yeah.
We love working with them.
We
Yeah.
can tell.
Yeah. It's awesome. Great work.
And then this group was also awarded the MEMS Executive Director's Award for Excellence in EMS because of this program. So it's recognized throughout the state. I mean, the hard work of these ladies sitting here, and then David Fippen, again, it's just unbelievable what they accomplished together. So,
Takes a team.
exactly.
Fantastic.
Thank you for what you do.
Thank you.
Thank you all.
Thank you very much.
Thank you.
Appreciate it.
Yeah. Thanks, Chief. Next up, we have Ron. I didn't see Ron here. Ron's here. He snuck in. Come on up. We're now going to talk about garbage, yard waste, and refuse.
Yes, sir.
Fantastic. Fantastic.
Okay, we made a couple of revisions to Chapter 8.16 of the City Municipal Code that deals with sanitation, as Jack alluded to. And what I'm going to do, I'm going to go over the revisions that we proposed real quick, and then I can open the floor for any questions for if you need clarification or anything. First one up would be we inserted a can replacement policy into the Chapter 816. There was never one in there, so this is something that's brand new. It was not revised, so we added that to it. Also in that can replacement policy is a statement that the determinant of can replacement under that warranty is at the discretion of the sanitation superintendent. Last time we ran over this chapter a couple of months ago. There's a lot of questions raised about the term high density, because we referred to high density as far as the trash corrals, things like that. So the question came up, and I think it was Hardy that raised it, what is high density? So what we did, we defined high density as a multi-unit complex where trash is disposed of by residents in a common area. So that was a better way to say than the communities with the big black trash cans. So it's where everybody throws trash in a common area. So that was the definition of that. As far as bulk item disposal, what multi-unit complexes, the city is not going to do that. We will help coordinate that with the managing authority of a multi-unit complex. But our determination is, and our proposal is, that any bulk item disposal at a multi-unit complex is the managing authority's responsibility, as which it is right now. It currently is that way. Next up was the for yard waste, a resident would have to call into the Field Operations Center by 6 a.m. on Monday morning. What that did was place an undue burden on the ladies that came in at 8 o'clock and retrieve a bunch of voice messages that had been left all weekend. And I'm not kidding, sometimes there's over 150, 160 voice messages. So they're coming in at 8 o'clock, taking all these messages off. Then they put them on a spreadsheet, and then my drivers on occasion have to sit around and wait for that list to come out, so we go on a second run. So now residents need to call by 12 o'clock on Friday. So when the ladies come in the admin ladies come in on Monday morning, they're not flooded out with voice messages for yard waste pickup. And the only other item we had here was when we do pick up bulk items, any household fabric, any household item that contains fabric needs to be wrapped and sealed in plastic. There were references to infested bed bugs, things like that. We scratched that completely out of it because we don't want a resident to feel isolated if they have bed bugs and they have to wrap it in plastic. So everybody has to wrap it in plastic so it doesn't put somebody, they can feel awkward, I guess, the best term would be for that. And that's about it in summary of the changes. Any questions?
On the calling in for bulk pickup, have we thought about doing like an online, like where you can go on the city website and fill a form out so that it submits it and drops it into a queue or whatever sheet that they can get the list, and which might help with trying to answer all the phones and probably save them a lot of time?
We do have that right now,
Okay.
but we don't have the ability for a resident to go in and ask for a bulk pickup and pay for it online. They still have to call the finance department and pay for it. So there's some tweaks that got to be worked out of that. But yes, you're correct, that would save some phone calls. And to be honest with you, it's not the bulk phone calls that come in, it is the request for yard waste.
Well, I mean,
And
yeah,
you
I
can
mean,
do that, you should
if
be
you
able
had
to do
a
that.
list on it where you could do yard waste or bulk pickup, and even if it, I don't know if there's a possibility when they do it, do they gotta pay for that ahead of time, or is that added to the,
Bulk pickup has to be
be
paid
paid
for
ahead of time? Okay.
Now, yard waste, there's no charge for
Yeah.
yard waste.
So to add to that, you know, we have the capability of doing, you know, a submission form for any service. So, you know, it could be yard waste, it could be bulk pickup, that could be one form with different, you know, buttons. But the payment side of this, that bid went out recently, or the RFP went out recently for total overhaul of all payment services. Keith's staff is reviewing the responses to that, and all of them are like 200-page responses. They're massive. But I mean, it's all of the companies claim that they can do all of the things. Whether or not that's true, you know, you have to verify and you have to talk to previous customers. But I mean, everything from pay by text, pay by voice, where you can simply say on the phone, like if at 3 a.m. you have an issue and you want to pay, I mean, there's all sorts of services. You know, instant pay or direct debit. I mean, everything, every payment mechanism you can think of is a part of the.
Well, I mean, we already have the ability to pay our water or sewer bill
Yes.
line through that system. Is that something we can't create something within that framework?
Not with our current vendor. We can't add anything under the current vendor, but we're selecting new vendors. We won't be doing business with that entity anymore.
I mean, even if, the only other thing I could think of is there an option to tack that on to the water bill? I don't know if that's, like, if there's ability to do that.
Yeah, I would just say by the time we're in the next quarter, you're going to be awarding a bid to a vendor who's going to be
Yeah.
building you a custom system for us.
Okay.
But, I mean, if it's critical that we find some interim way of charging people, I'm sure we can. But,
Yeah. I
but-
just didn't know if there was a possibility in the current system we had to be
you
able
know,
to.
the other thing that will come in as part of that is the ability to pay monthly instead of
Yeah.
quarterly, as we've talked about.
That's huge. I think.
Yeah, so I think there's
We could certainly do the form with,
easily.
that could be done in 10 minutes.
And then just figuring out how to bill for that, whether that's on a water bill.
And that might be good
or-
anyway, especially if we're just doing the regular yard waste and,
Yeah.
and all that. And then once we get to the
Yeah.
bigger, bulk pickup, I think that's a good idea to, like you said, just do it this other way.
I think we could figure out how to bill for that in the interim until the new vendor is in place, until, the new
Add a
system is in place.
PayPal link onto it.
Sure.
I mean, everybody uses PayPal, right? I mean,
Yeah,
Yeah.
yep. Ron, I know that you and your team have met with the multi-unit complexes. Did they see these definition changes by any chance during any of the meetings that
No,
you
but I
had?
did get a phone call after it was posted for the public.
Oh, okay.
This past Wednesday or Thursday.
Okay.
And their concern was they interpreted this, that we're not gonna empty their trash anymore. And I said, no, it's just about
Yeah,
the bulk items, the furniture and things like that. So they were okay with it.
because for everybody who doesn't know, Ron met with the multi-unit managers, had very good meetings, taking a proactive approach and a sugar approach versus a stick approach, and it's made a big difference. And I think that the more we do that, and the more we can keep ahead of it, I commend you, and I think that's the appropriate way to go. You get more I think you get more results and better results by doing that. So, any other questions relative to this?
I just had 2 edits. Mark, line 94 to capitalize city, and then
Wait a second.
line 109 I'd like to capitalize city service center.
What was the other one, 109?
94 and 109, city and city service center.
Oh, City Service Center. Yeah. Gotcha. Okay. Any problem moving this forward? Anybody? Good, thanks, Ron, appreciate it very much.
Thank you.
Okay, next up, Mrs. Pollock, another cast of thousands.
Yes.
How are you?
Good, how are you?
All the chairs are warm.
Let everybody get settled.
Yeah, let's make sure you get enough mics. Get procurement to go out and buy more mics.
And turn Jim's around.
Yeah, we'll turn Jim's around.
Yeah, for laptop.
You can share.
Yes.
We're technologically.
While they're getting set up, I'll do a brief introduction and then have everybody introduce themselves as well. So this is our first introduction on the Court Plaza annexation. And this is the initial meeting where we're really here to get your feedback. So this is to present the project and talk about any concerns that you may have or things that we should consider adding in the annexation agreement. Today, once we get all set up, you'll see the overall concept. We'll talk about the next steps and where they're going from here. We received the annexation petition this afternoon, and potential next step would be going to Planning Commission, depending on what your concerns are, and to have Planning Commission give a recommendation on the zoning. And that could happen as early as their March 21st meeting. We have had some preliminary meetings, and they did have a kickoff with State Highway Administration, so we're aware of what needs to get done from a traffic impact study perspective. But I think it's probably the appropriate time now to go ahead and introduce the whole team. We'll start with Eric, or you.
Sure. Eric Berkheimer, Salisbury University, Associate Vice President of Facilities Management.
I'm Jeff Harmon with Becker Morgan Group. I'm the civil engineer on the project.
Hi, I'm Tom Ziegenfuss. I'm a principal with Design Collective. I'm an architect on the project.
Hi, I'm Jason Taylor. I'm managing director with Graystar, with the developer of the project.
And I'm Michael Sullivan, the city's annexation consultant.
Okay, so I'm going to turn it over to Tom initially to run you through the project.
Great. Okay, so I'm just going to briefly, actually, I'm going to go to a slightly different view to do a view of the existing site a little bit here, just so people can remember if everyone's familiar with the site. The site that we're looking at today is bound by Court Plaza Lane, K Avenue, South Salisbury, and Pine Bluff, with some interstitial sort of parcels that are not included in the overall site. You can see that right now it's primarily a lot of impervious surfaces and a lot of parking, and obviously the old hotel that was there before, right at the corner of K. And you can see that there's this the Wesley Drive, which is the drive to the north, which you can't really see the name of it, but I think everyone knows the street is connecting obviously directly back to the heart of the university, and so that's going to be an important sort of driver for the design as we dive into it here. So now the plan is rotated so that north is actually to the right side of the page. And to the right, you can start to see, if everyone can see the mouse here, does it show up? Yeah. So over here, you can see that's Wesley Drive here, and then K Avenue is all the way to the left side, South Salisbury to the bottom, and then Court Plaza to the north, or to the plan north. So this is a student housing project for roughly 776 students, and about 606 of those are replacement beds. So there's about 142 new beds for the university. And one of the big driving forces for the design was to look at the different population types and look at how it fits into the urban context, and really start to try to integrate a real campus aesthetic that also creates a gateway along Salisbury Boulevard to this corner here along K, and to really create a connection from the heart of the development to the campus. And so one of the things that's going to be happening on Wesley is that will be improved. There'll be a series of improvements to the sidewalks along that street with lighting and streetscape that'll start to make that have a much stronger connection back to the campus core. That became one of the driving forces for the circulation through the site. And so what you see is the first building that is on the sort of plan north is that'll be the sophomore project, and that'll have about 296 beds for freshman students. And so that's in a suite style for those unit types. And then the other two buildings are essentially creating this large courtyard space that'll be this kind of quiet contemplative space that opens up at the corner to create this gateway component that not only signifies entering into the sort of being part of the Salisbury University campus, but also sort of your arrival to the city as well. And so we see this as a really important element, and you'll see that in one of the renderings coming up. So the idea was really to create this courtyard space that would be this community gathering space for the students that would start to be really reminiscent to what some of the spaces are that are on campus. Much more sort of a place for passive recreation and for gathering and meeting, and then connecting that along this pedestrian spine back to Wesley and then back to the campus proper, so that you really start to feel that connection to the project. And then architecturally what will happen is there will be these elements and these opportunities to create corner spaces with a lot of glass to really create this kind of beacon effect that'll be a direct kind of visual marker for students as they're coming from the campus core at each of these corners. The other thing that will happen is that there will be a lot of ground floor amenity uses that will really activate the space and create a really active sort of pedestrian environment for the students as well. So you begin to see that connection that pulls you through and then into the project. At the ground floor of each of the buildings, like we said in the freshman residence hall, the amenity space would be activating this end, and then in the apartment 2 buildings, there would be amenity space to the far end, and then a mix of uses in what we're calling building 2 right now. And that's about 21,000 square feet right now of space on the ground floor that will be developed to decide, how much retail it needs to be in there and how much amenity space needs to be in there. So we're not sure exactly how it'll shake out, but we're starting to see an idea that maybe there's more student services, more focused towards the center of the project, and more retail uses that'll be for the community along Route 13. And then as you go up through the building, it's quite a simple plan. You have these active lounges, like I said, will become these beacons, and we'll start to draw students into the precinct. And then you can see the way the general configuration of the units works. So this is a view looking towards the northwest from at the corner of K and South Salisbury Boulevard. And it was just an early conceptual view with this idea of creating a real gateway element, so a plaza space here, active retail on the ground floor of Building 2, some amenity spaces in Building 1 to really create this indoor-outdoor living environment that will then hopefully spill out to the courtyard as well. One of the things that came out of one of our initial meetings was that maybe if we have a visual marker on the site like we're showing on this side, maybe that should actually be pushed to the other building, Building 2, because it will be more visible as you're coming north along South Salisbury Boulevard. And this is just an early conceptual view of that interior courtyard space. Again, it's a space for students to have passive recreation. They can do outdoor learning classrooms out here, similar to what's kind of happening behind Seagull Square if you've seen that development. But again, with a lot of active uses on the ground floor to really kind of get those students out of the buildings and into the landscape when it's a nice day. Just some numbers about the buildings, just showing the total number of beds and the total number of communities. Again, we have a total of 144 apartment units and 90 freshman units. And we have done some preliminary meeting with the fire marshal already, looking at some of the, just trying to get their feelings for some of our initial strategies for how to service the buildings for fire, and we've gotten some good buy-in on that already, so that's been very helpful. Jeff, did you want to talk at all about some of the parking and stormwater issues at all? Or?
Sure. I guess I'll probably start towards the outside and work my way in from the site. So from an access standpoint, as Amanda mentioned, we've already sort of had some initial conversations with SHA and what they'd like to see. And as you know, there's a lot of retail uses there now. There's a lot of curb cuts, and we just don't need them all. So we're going to go in and close at least 2, I think maybe 3 of the curb cuts that are out there, and then do further improvements to the remaining entrances that are there. SHA is on board with that idea, likes it, so we've already got the initial concept buy-in from them, but they have asked for a traffic impact study, so we are moving forward with getting that done. From a traffic standpoint, we don't expect to see any kind of increase in traffic here. It will probably be a decrease in traffic because we're going from a retail use where we have a lot of coming and going, and we're going to a more student-centered use. And so my daughter just graduated college, and she went there 4 years, and she didn't have a car the entire 4 years she was there. And that's probably going to be true of a large population of the students that are here, that not every student that's on campus has a car. So some students just won't have one there, and then other students will actually park elsewhere. So from a parking standpoint, a couple things going on. Number one, we're going to be using Salisbury's new parking code that they have, which is a maximum required parking now rather than a minimum required parking. And so we're looking at that. For example, if we were to assume the number 15,000 square feet of retail, That's only 30 parking spaces that we need to have, and we're currently showing about 200 spaces throughout the site there. So we've got more than enough, but when we add the component in for the residential portion, we'll be working with the city on how to define that and what the required parking is. One thing that Salisbury has an abundance of is actually parking throughout the entire campus. They do have remote lots. A lot of the freshmen are required, if they have a car on campus, to use the remote lots. And is that Dresser?
Yes.
Okay, so the Dresser parking lot on the other side of 13, the students have to park there and then walk. So most of the time throughout the day, they're not going to get in a car to go, to class or something. They're just going to walk, because it's actually longer to get to their car than it is for them to get to where they're going on campus. So we'll expect to see that this will have minimal impact, if not an improvement to what's there now.
Yeah, these are net new spaces. So these buildings are replacing essentially 3 buildings on campus, Chesapeake Hall, St. Martin Hall, and Dogwood Village.
That's one of my questions.
So those folks are already on campus. If they do have cars, they're parking on East Campus. So what we're building here for parking actually is new, nets, gets us more for the campus as a whole. So we think that makes a lot of sense.
Should we wait to ask questions, or?
Oh, no, anytime.
Yeah, jump in anytime.
Let me,
Yeah.
just a couple of questions. What's the reduction of impervious surface?
That's a great question. I haven't calculated the number yet, but it is a reduction in impervious coverage. What's out there right now is a lot of paved parking, a lot of buildings, and there's very little grass. This will be a significant reduction in impervious coverage, and we plan on doing enhanced stormwater as well. We're not just going to pre-development levels. We're going from the 10-year got that backwards. The 10-year post will be held to the 2-year pre-level. And so we're going to do a significant reduction in runoff. But we probably won't need a lot of stormwater facilities to do that, because we're adding so much grass area in. We've got the large courtyard. We've got around the perimeter, you can see a lot of landscaping areas, a lot of walkways. We do show some bioretention scattered throughout the site, because we will need something to treat for water quality too. But we're expecting to see a substantial reduction in runoff from the project.
I'll give you a heads up. That's going to be one of my questions at the Planning Commission.
Okay.
What's the reduction in?
Yep, and when we get to that point, we'll probably have some numbers at that point in time that we can share. We just
Okay.
haven't gotten into the calculations yet. But
For a second, I read the SWM as swim. I thought they were swim spots. But now I see there's not an I in there.
Yeah, don't feel
And-
bad. I thought the same thing.
And the other question I had is, the tallest building, how many stories?
5 stories. Yeah.
5.
I had several questions. I wanted to ask some things, maybe just on a historic perspective, as well as something to clarify. When you talk about replacement beds and additional beds, can you give me a differential on that? What does replacement beds mean versus additional beds?
So
What
we-
beds are they replacing? The ones that are on campus currently?
So we have 3 housing complexes on campus that will be replaced. Those facilities currently house 606 students. So those are the replacement beds. Then we also have a wait list that we keep, and we know that we have a wait list anywhere on a given year between 100 and 150 students. So we know that we can also fill those beds. Obviously, we're not going to build them if we can't fill them. So that's the delta there.
Speaking of the beds that you have, or filling, what is the utilization of the existing housing? The University Orchard, the other university developments that were off of South Division?
The Gathering.
The Gathering.
Because there was can you explain that to me, the utilization of those housing developments? There's a lot of...
So those are third-party private developers. There's a speculative builders who build housing near campuses. They do it all over the country. They market towards upperclassmen, juniors, seniors. Typically after, most students want to move off campus after their sophomore year typically. So they want to kind of get that bridge experience of being in the university, a little bit more independence. So those are groups that obviously we work with. They come to our housing fairs, but we don't operate those facilities. They're just as parties to us. We certainly want to make sure that they're reputable, but we have little control over how they operate as a student housing complex.
Do you know what their utilization is?
It varies. It depends on who you ask. If you ask them, the numbers are typically pretty good. It depends, I think, things like University Village have had low utilization. Every time a new property comes on market, it seems like they steal the folks. They have good utilization, good occupancy rates. And then the older properties then kind of dwindle. So now actually you'll see University Village is going back in and they're rehabbing their property and also kind of doing promotions to then get their occupancy rates back up. So those vary year to year depending on what comes on market and who's doing renovations. Kind of obviously the new shiny thing seems to be the kind of most popular destination.
Yeah,
but
that's what I'm exactly. I wanted to ask another question too about this housing with these independent contractors who come in here and build the university housing. There was a lot of underutilization of the college students, and a lot of people in the community were renting those particular units. One of the things I wanted to know is anyone thought of or asked what the impact was on the actual rental rates here as far as housing rates for Salisbury? I wonder how that works because those apartments, I think, impact what some of the our local renters pay. Is that accurate to say or not?
No, and I can speak to that.
Speak to that.
It doesn't matter who they market to. What matters is the number of bedrooms and who's likely to rent from someone like that. And so the most recent market study that we've seen is 1.4% vacancy in the rental housing market in Salisbury. So an incredibly, almost scary low vacancy, which what you're going to see is what we're seeing right now is constant continued pressure for new construction of apartments in and around Salisbury. So it's why we've got 2,000 permitted apartments over on Beagland Park Drive under construction right now, and you're just going to see more and more and more. So the only thing likely to reduce the cost is if we see an increase in supply. Demand is high, supply is low, price is high.
That's right, the price is high, and we have the independent housing that targets the university students versus this project, which is a university project, sponsored project, correct? And I'm just worried about saturation of a product too. I'm just trying to get a grip about how that all pans out over 5 years, 10 years, 15 years down the road. I don't want this to become another, blank or torn down or dilapidated housing development.
Well,
not saying this
correct me if I'm
happens,
wrong,
but-
but I think this covers the mandated population on campus, correct?
Yeah, we have a
So there's a-
freshman, sophomore residency requirement.
Right.
So those people that we're bringing in, we have to provide those beds. So we know that number, we control that number. And so therefore, we can make sure that what's going in there, and we're actually, since we will operate this, we'll be pushing students into those. So they'll be required to stay in our housing on campus. So this would be included in that portfolio.
Just a couple other things, if you don't mind me asking. You're saying the traffic study it's in the works or in the pipeline? Okay. What are the percentage of students that are parking on campus versus slots that aren't available?
I don't have that number off the top of my head as far as percentage. We could certainly run the numbers and see what the number of permits that we sell on an annual basis. But we do sell a few thousand permits on an annual basis to students.
Is that parking garage full? Is that full? You
Yes, it
guys
is.
gotta be full, okay. Because I know when I was a student there, parking's always a nightmare, and I just wanna look at parking and traffic in that area. I don't wanna get really congested down there. And what are the buildings that it's gonna replace again on campus? You said it
So that's Chesapeake Hall,
was-
St. Martin Hall, and Dogwood Village.
All
It's those
fond
three.
memories, yeah.
There you go.
All fond memories. Okay, I'm just questioning, thank you for clarification.
I have a couple of things. In your parking element and parking plan, are you going to be creating spaces for bike parking?
Absolutely, yeah. Certainly, we expect, as part of being sustainable, we are definitely promoting biking, pedestrian access to campus, especially with this being as far south as it is. It'll be perceived as a long distance back to campus because we are so compact and we have that luxury, but this is really going to be seen as an expansion. So we certainly expect that corridor on Wesley to be highly utilized by bikes.
Okay.
We're working with folks here at the city as far as bike share, scooters, all those kind of things. So we certainly expect that. We want to provide amenities. We've added hundreds of bike racks on campus over the years, and we certainly expect to have a full cadre of them here as well.
Good, okay. Next one I have is the property owner of this property, is this Salisbury University or is it Graystar?
The property is owned by the Salisbury University Foundation.
Okay.
So it's not a state-owned property.
Okay, so it's a taxable piece of property, okay.
Yep.
All right.
And is that compared similar to the housing that is by the Cheers and?
Seagull Square?
Seagull
Is that the
Square.
same- Is it the same?
It's similar, yes.
And then I just have one other thought, and what is the Court Plaza Lane? Are you, I mean, I know you got some parking spots on that road. Have you considered not having any parking spots on there at all? Because I know Salisbury, and I know how people drive in Salisbury. This is actually a telepathic Jim Ireton question. He just sent that to me mentally. You just consider maybe not having any parking spaces on that own, because is that currently a county street?
It is currently.
So will it remain a street
Actually, it's
and will it become a
private.
city
Yeah,
street?
actually, right now it's private.
It's private, okay.
Right.
Yeah, no, we've talked about some traffic calming measures there. There's some uniqueness there with some agreements with other properties as far as parking, so we want to make sure that we acknowledge what they need as well, but we're certainly, we don't want to have that be kind of a speedway as people dart through there. We're certainly concerned about that from a safety standpoint.
From a aesthetic look, a couple more questions. The lighting on the lighting in the campus, downtown light types,
Standard.
similar
Yes.
to the standard, so it'll all match.
Yes.
What about the street Camden going?
Camden Avenue, so right now Camden Avenue is not included in this annexation. They're contiguous to city limits on Route 13.
Gotcha.
So we do plan to pursue that in the future, and Eric could speak to that timing. So that's a goal, I think, of all of ours, the city and the universities. But we couldn't do that right now because if we try to annex up Wesley
No, just
Drive,
on the whole.
we would have,
I got you.
we would leave an island.
I'm just trying to, in case I'm
Yes.
not here
Sure.
when that happens, we would like to have the look going down.
This is a short-term
absolutely.
goal, I just.
Yeah, I think we've talked with staff about a phase 1, phase 2 annexation. That obviously this project is on a fast track. We don't want to bog it down with any other just steps along the way working with other property owners. But we do want to annex the rest of the main campus, including satellite properties on Camden. And that's really where the little kind of glitch is, because there are 3, 4, 5 little properties on there that we'd like to approach the owners and see if they're interested. But we know that would delay the process.
No, I understand.
Yep. But no, our goal would be to certainly have Camden, Dogwood, all those streets feel exactly the same.
Perfect.
I want to go back to Seagull Square for a minute, if you don't mind. The retail in there, sometimes there's a lot of inconsistency with that. It's not, some of the businesses open and close with that. So, I see here, there's a section for like a retail. How are you utilizing the Seagull Square retail versus then having other retail that's just gonna sit there empty or open and close, open and close?
Well, That's why we have Brad Gillis as part of our team in Devereux. So certainly, we know and we acknowledge the issues. There are definitely pieces of Seagull Square. We've heard issues about parking, access, some things that we think are challenges there. Obviously, we don't want to repeat that, and we don't want to cannibalize it either. We, as the kind of the owner of the property, we get ground rent from Blair Rainier and his tenants. So we have a vested interest in that property as well, not being vacant. So certainly working with that, we're working with him to try to see what we can do to improve that, as well as whatever we put in here, make sure that we don't compete or steal tenants from one to another. But we're certainly, and we're not far enough along in the process yet to really know what type of tenants we're going to approach and market to. That's part of, we're still a little ways off of that, but we certainly are eyes wide open as far as the issues at Seagull Square and how we can help that as well as not cannibalize this project.
That'd be a good spot for Rise Up.
I think the one thing we want to, ensure from a government standpoint is that this type of product where there is a mix of housing and retail that's the key. And I think as long as we continue to encourage that there is that product, whether it's redesigned compared to Seagull Square, or, there's a market issue and not a. There's an economic issue there, but not a market viability issue. I don't think it's just somebody's got to make the numbers work to keep their business sustainable there. The other thing that I just wanted to note, if we can go back real quick, Mr. President, to the question of the remainder of campus. I think one of the things that I would say to council, and Eric, if you can speak to timeline a little bit, that would be helpful. I think we agree that we don't want to slow anything down, but at the same time, we're here now, we're here today, and we know that that's the intent. So whatever we can do to ensure that all parties understand what the full spectrum looks like, as well as phase one, if we can see what phase two looks like too, and have some sort of agreement on what that timeline would look like. I think that would certainly give me more comfort, and I would think would give council more comfort as well. So anything that you know today with respect to timeline, I think would be helpful to share, if that's possible, if I could ask for that. And if not, and if the answer is nothing yet, then maybe we can start to work to put timeline on paper.
Yeah, I don't think we have anything certainly that we can commit to as a date, but working with Amanda and certainly we want to look at, okay, what is the process to reach out to those handful of owners along Camden so that we can bring them in. Obviously, we want to make sure that we have a good pitch to them to a certain extent and make sure that they're on board with why it makes sense to come into the city. Obviously, our goal is to get that unified streetscape and have it, have sidewalks, have lighting, have all the things that we want, because we know students are going to be using that corridor. Expediently, I guess, is kind of my answer. Certainly we intend to reach out to those few and start that process. And honestly, if we get pushback, then I think we're not married to that we don't have to have those handful of properties with us, but it'd be nice to go through the process once versus doing it multiple times. Yeah. But if we get pushback, then I think we'd commit to just moving forward with what we have and what we control. Whether that takes a year or two, I would hope not that long, but I can certainly say that we'll endeavor to move that along quickly and go from there.
What I didn't hear was cameras, safety issues. I didn't hear.
That's standard on our campus. We have hundreds, and seemingly every day a few more pop up. This would be no different. All of our buildings, every entrance is covered. Generally, the kind of perimeter of the parking, whatnot, is covered. Obviously, from our standpoint, safety is priority number one. Students won't come to our campus if it's not safe. We have a vested interest in that, and we have blue light phones, which is basically you can run up to that, you hit the big red button, and it immediately connects you with our dispatch. So our university police will be the ones who have control or have authority on this property. We'll take care of our own waste, physical, we'll do the normal things that we do from that perspective. So certainly from a city services standpoint, we don't expect there to be really any significant impacts.
Well, because I didn't hear it, and I asked because if you don't ask, you'll never know. I know that you would have security, but I wanted to know to what magnitude.
Yeah, and we have talked about even having a satellite police station there, a substation essentially. We have a few
That's
on
great.
campus, and we think that with this being where it is, again, freshmen, sophomore, younger students, we definitely think that's, one of those central locations that we have mixed-use amenities. I certainly expect that we'll have some type of security office there and presence.
Okay. Thank you.
Okay. Any other questions? I think I give a heads up, environment is going to be important, certainly, especially at the planning commission level. And you said, if I'm not mistaken, to target 21st of March?
That's the target from the last time we met. So,
Okay.
and that is the next step. They'll go and seek a zoning recommendation.
Right.
They'll also need a special exception for the density. So we'll be taking those items to planning commission if we get their package here this week, so we'll be taking it in March.
Okay. Any other questions? Thank you very much. Appreciate it.
Thank you.
Thank you very much.
Appreciate your time.
Mike?
Thank you.
Oh my gosh.
Yeah, don't steal. They'll bill us. Okay, next up, this is Paula.
Yes, yeah, I'm here for a little while.
Well, we're glad to have you.
Thanks. I'm going to invite Bill Holland up for this next one.
Come on
If
up,
not, I
Bill.
was gonna call him up.
Okay.
Evening, Bill. How are you?
Evening, fine,
It is
thank you.
evening now.
Before you is a resolution and other supporting documentation, which the end result will be adjusting the city corporate boundary by approximately 3/4 of an acre. Reason for this, back in around October 2006, the city council then passed a resolution to annex the Sassafras Meadows and the Westwood Development annexation. Inadvertently, when they drew the lines, it went through the middle of 1410 West Road, and it was never picked up until recently. It was sold about this time last year to Mr. Kevin Smith, who's been sitting back there quietly in the corner. And so this has to take the same process as an annexation, except we won't have to go to the Planning Commission. I'll have to forward this information to state planning, and probably won't get much feedback or anything. But the next procedure then will be to introduce the resolution to set the public hearing date, and that's when you'll be hearing from me again.
Who did the survey? No? We?
Oh, back in 2006, was it Parker and Associates?
Parker? Is he going to refund? Who paid for it? Do we pay for it?
For the annexation, it would have been whoever had petitioned for annexation at the time.
Gotcha, they paid for it.
Right.
You should get a refund, whoever you are. We have to make it right.
I think so.
Okay. Any questions?
No.
Just
go.
Well, I'm good.
Angela? Good? You're good.
Okay, all right, we'll be getting back with you.
Thank you.
High five.
Yeah, thanks.
Sorry about the confusion. 2006. 2006.
Yes.
Start
It has been
wares.
a long, and they've been here for a while, too.
3/4 of an acre.
Right.
10 feet, 5 feet, 3/4 of an
But
acre.
it makes all the difference.
I mean, and if nothing is right, like a few years ago, we went to go refinance our property, and when we purchased our home in 2006, the paperwork was, the zip code was wrong. And so we were trying to refinance, and it would never go through, and then finally they figured out the zip code was wrong.
and they had not been billed city taxes, which is good. You know, where it was just an incorrectly drawn line,
Yeah,
at
'cause
least
it
it
wasn't-
never triggered taxes or anything.
Good.
So, yes, that is good.
That's really good. Okay, next up.
I'm
This is
surprised. This is to discuss the Chesapeake Bay Trust Cooperative Agreement, and I have two people I'd like to invite up, Tom Lee and Sadie Drescher. So this is Tom Lee from the Chesapeake Bay Foundation and Sadie Drescher from the Chesapeake Bay Trust. And I want to give you a little bit of background on how we got here today, how we got to this point, and then
Okay.
I'll give them an opportunity to speak. So Salisbury is part of a coalition. We went in on a grant with some other jurisdictions. We're one of 6 jurisdictions, and we were awarded a National Fish and Wildlife Federation grant in early 2018. There was funding provided also by Maryland Department of the Environment, and the 6 jurisdictions are Salisbury, Cambridge, Easton, Oxford, Queen Anne's County, and Talbot County. So we were originally part of the Healthy Waters Roundtable. We broke off as sort of a subsection, all with an interest to hire a circuit rider to help us with our stormwater needs. And the needs could range from procurement to grant writing to just training opportunities, but really with a common goal. And it's been very helpful. It's great to get together with these 6 jurisdictions, and MDE comes to all of our meetings, brainstorm ideas, and really see where we all are with our different programs. As you know, the city has an MS4 permit, a municipal separate storm sewer system. It's our 4 S's. And so we have certain requirements that we have to meet under that permit. We also have the watershed implementation plan goals to clean up the river. So there are a lot of goals that we have for water quality, and we have many, many tools to try to achieve those goals. So with the 6 jurisdiction coalition, Tom was hired as our circuit rider. So Tom works directly for the Chesapeake Bay Foundation because they were willing to be the host agency to host this person. It would have been very difficult for any of the 6 jurisdictions to actually be the host. So Tom hosts meetings for all 6 jurisdictions and brings forth different opportunities for us. So one of the opportunities he presented to us, I think back in September, was a program that Chesapeake Bay Trust has. And Chesapeake Bay Trust, and Sadie will be able to speak to this a little bit better, but the introduction, they can manage funds from different jurisdictions to help implement projects. So Anne Arundel County came to our meeting and talked about what they do for Anne Arundel County. And they put in approximately $1 million each year. The trust then solicits proposals from non-government agencies, nonprofits, to then carry out projects. So they would have specific goals, whether it's public outreach or water quality goals. You would use Anne Arundel County's money run by Chesapeake Bay Trust to approach and then manage these projects. So for us as an opportunity, I was very interested to hear Anne Arundel County speak. I thought this is a nice opportunity for us. Right now, we have the stormwater utility, and what we typically do is we contract out for design, we design a project, we bid it, we construct it. And that's a fine model, and that'll work for some things, but there is certainly an opportunity to enhance that. And I see this as another tool for us, and this supports our staff and gives us another angle to be able to implement projects that's less traditional. So we will always continue to keep doing that model of traditional projects, but I feel like one of the benefits here is that Chesapeake Bay Trust can reach organizations that we may have a harder time reaching, possibly homeowners associations or churches or different groups that maybe isn't our #1 target because we're focused on trying to do a project in this location. They can reach some different groups. So what we're presenting today is their cooperative agreement, and I'm going to turn it over to Sadie in a minute to talk about it. What I'm proposing, you would establish essentially the amount that we would put into a grant fund on each year on the budget cycle. So I have put in a request in my FY20 budget as part of my operating budget, maintaining the level of funding that we were required to do. And the request for next year is $50,000, which maybe doesn't sound like a lot compared to Anne Arundel's, but it's a great start for us, and it would help us identify organizations that would apply and projects. And as Sadie could mention, if we get a lot of really great applications, it's possible that some of their grants could pick up some of the gaps in funding if we don't have enough money. But we would look at this, the agreement spans more than just 1 year, but we would look at the funding level on an annual basis. So let me turn it over to Sadie for that.
Well, thanks for having us here today. It's nice to see you all, and Amanda did a great job setting it up. I want to first say thanks to Tom Lee, who helped bring this group together, and just acknowledge all the great work the City of Salisbury is doing. So we met with Amanda and her team. If you don't know us, Chesapeake Bay Trust, this is our new annual report. So we're the license plate folks. You know, we're nonprofit set up by state legislature, though. So we have a goal of doing environmental restoration through on-the-ground projects, getting kids outside, teachers outside, training them, and getting citizens engaged. So we have our own dollars, but we partner with a lot of other folks, as you'll see in our annual report. Lots of different counties and cities all over to do just exactly what Amanda's saying. Different organizations, cities and counties and states, they have fun, and EPA, federal government, they have funds that they want to spend, and they have things they want to do. Like in your case, you might want to do citizen engagement, kind of getting faith-based organizations, homeowners organizations out and involved in kind of the good work that you're doing. So while Amanda's focused on the capital improvement projects, getting those done, these groups can kind of get funding, learn how to do the grant project, do the paperwork, but then feel really involved and have a beautiful project at the end. So there's a lot of benefit for both you guys and for us. So this is what we're offering for you all. And like I said, we do it for lots of other jurisdictions, and Anne Arundel County came and kind of talked about the work that we do with them. Just some others that we worked with, Prince George's County, Baltimore City, Harford County, Howard County, and I could go on, Charles County, small MOUs and large MOUs. And we were just talking to Queen Anne's County before we came here. So the MOU that's in your packet that we provided to Amanda, and she ran through her team, it's pretty standard. It's your contract with us to do work. It is for 5 years, so 3 years of a grant program, and every year Amanda and you guys would tell us exactly what you want to allot, and you would never support any project that you weren't 100% behind. But it does go through, all the applications go through a review process, so there's good transparency, very fair. And we take care of all that for you all. We come really cheap because this is our mission and this is what we like to do, so we take a very small administrative fee and then kind of just deliver the good results to you all. We can do a press event. I'll actually be spearheading this grant program myself. I'm Director of Restoration Programs, and I have a team of 3, but I want to get out in front of this and kind of be here in your community since this will be a new partnership with you all. But we have had grants in City of Salisbury before. In fact, you've been a grantee. Amanda's running a wonderful Green Streets Award that you guys got from us. So we're familiar with some of the organizations here and would like to get to know more. I guess, is that a good overview, Amanda?
Yeah, that's great. And Tom, did you have anything to add? Okay.
Here for questions only if need to be.
And
I have a question.
Oh, sure.
What is your role with HOAs? What typically do they engage
Oh, so that's a good question. We have an advertisement period, so we say kind of exactly what we're looking for in the request for proposal. That's out for about 3 months, and we do targeted advertisement, so we would email all the groups that we know. I actually wrote all of your names down so I can be in contact with you so you can let people know about this opportunity. But HOAs largely would come in and say, we have either an area that has some standing water, then we might do a small project, and so that might be a small rain garden project, and then you would put a sign there showing who funded it, what it does, and other businesses and residents that visit might kind of say, oh, that's a good idea, I could do that as well for a future project. Other things they might do, we've seen homeowners associations kind of say, okay, we want to get together around an issue to maybe do some kind of workshop or some kind of training, maybe learn about rain barrels or some other thing like not putting too much salt on parking lots during snowstorms. So just some examples like that. I don't know, Tom and Amanda, if you have other ideas.
Well, and I was going to say, we could potentially look to partner with Wicomico Environmental Trust and other local agencies, so an HOA could approach them and maybe what would actually take the lead on projects. And part of what Chesapeake Bay Trust does is capacity building for local organizations like that.
That's a great point, and I was just talking to John with Wicomico Environmental Trust today, so he's very aware of this program. Oh, hi.
Hi, John.
Did that answer your question?
Yes.
A couple of questions I have. One, how often does the group meet?
We have met, I guess, quarterly.
Quarterly for the water tap, for the circuit rider work that I do, yes, sir.
Okay.
And then as need be, I think Amanda and I and the other 5 partners, I have monthly check-ins. How am I doing? What do you need? Where are we with this? What's next?
We have a conference call this week. A lot of times we meet in Easton, But like this week, we have a conference call for a grant opportunity that's coming up, so it's kind of on an as-needed basis. But as you can imagine, it's a struggle for Tom to get all 6 of us together. It's very busy schedules.
And if I may, I'll speak to the HOA, Ms. Blake, in that when Amanda outlined the larger capital projects that she and her team and the other, large bang for your buck sort of investments in green infrastructure go, this trust package, the Chesapeake Bay Trust Package, is aimed at sort of the smaller aggregate, the homeowners associations, the houses of worship, stuff that really shouldn't be, quite honestly, on Amanda's to-do list, but in the aggregate can really help the city reach out to its constituents and get some real reductions in its wastewater, or its load allocations to the bay. So it sort of takes a little bit of the heat off of Amanda and puts it squarely on the Bay Trust, who does this day in, day out, has the computer infrastructure and the staff to manage it much more efficiently. And this is not a knock on Amanda's management at all, but it takes those sort of smaller, lighter burdens off her plate, and that's what the Bay Trust does day in, day out.
Just from, I've read this now, and I know that 2 questions really, which are fundamental. One is funding. I heard the amounts and goes into annual budget.
Yes.
The term of this MOU, did I miss it? Is it not?
It's from July 1st, 2019 through June 30th, 2024.
So it's a 5-year.
It's a 5-year. It's on page 2 of 11 of the MOU. So yes, a 5-year.
Oh, okay. So it's not in the resolution itself?
It's not, no.
Gotcha. Okay. So every year, you're going to have to put...
Exactly, yes. And starting with 50,000, because I felt like that was a manageable amount. I could do that within my level operating budget, and then that'll let me gauge what we would want to do for the following year. So, then we can kind of determine the success and say, is this the right amount? Do we need to, make a change?
Okay.
And our stormwater utility language, when we created the utility, did give us the opportunity to provide grants like this. It was written in very vaguely at the time that we could grant money from the utility.
Gotcha. Okay. Any other questions?
If I could just add, to Ms. Blake's question about HOAs, your HOA, which we've looked at, I thought when we first talked about this and when you all explained is the perfect candidate. So an early, hopefully, respondent to the request would be your HOA.
Instead of flooding?
Significant
Yeah.
significant issues on,
Yeah.
over at Stonegate.
Yeah. Okay. Good.
Great.
Any, moving on?
Yeah, absolutely.
Okay.
Thank you.
Very good, thank you.
Thank you for your time.
Thanks so much.
Well, Mr.
Thanks
Grout,
very much.
Thanks for
please with us.
You want to be first on the list?
We've got some stuff going on over there.
Yeah. Okay. Next up is the Riverwalk construction. You want us to send out for a negative muffin?
I don't have anyone to invite up this time, so it's just me. The numbers are dwindling as the night goes on. Okay, so this is a potential new program to help development along the Riverwalk. So we're calling this a Riverwalk Construction Reimbursement Program. This is targeting the downtown area, the central business district, and specifically where we have already in the ordinance designated for where we want the Riverwalk to go, including the North Prong. So this would be a program to essentially reimburse in part developers who are building the Riverwalk for the public use to reimburse some portion of the construction funding. So the construction costs that are eligible would include the actual bulkhead itself, the Riverwalk, bulkhead repairs, and anything associated with that, such as backfill. Lighting, landscaping, and signage is not included. That needs to be part of their project costs. So we're very specific that this is for the construction of the Riverwalk itself. We have a lot of input from the finance director and the city's attorney's office, so there's very specific criteria on how they would apply. It's not dissimilar from programs like the EDU Free Zone, where each application would go through my office, then the mayor's office, and then we would come back to you and accept each one via resolution. So you'll see input and have input every time we get this application. There's a little equation in here that there's the overall costs, but their eligible costs are 75% of their overall qualifying costs. And then there's the way that they get reimbursed. It's on an annual basis over a maximum of 20 years, and that is capped at an amount equal to or less than the sum total of 90% of the incremental increase in city property taxes due. So this is not a lump sum reimbursement. We're not paying in advance. They are constructing it. They're giving us an estimate at the time that they're going to construct it. We're locking into costs on day one. If it ends up costing them more, that was their risk. You know, we're looking at actual costs and we're locking in at the beginning, and then we'll pay them back over a period of up to 20 years.
If there was a project that had a specific type of landscaping that would be something that would significantly reduce runoff or something, would that qualify?
It wouldn't. No, it really wouldn't. And so, you know, any of these projects have to provide a buffer, some type of a buffer, and so they are required to do that themselves. We're not going to pay for landscaping. We were really trying to pay for that heavy lift of the structural improvements and the physical Riverwalk itself. So
Because you're kind of hearing you're kind of hearing from anybody on the Riverwalk. They're basically saying to us, yeah, great, we fully intended on doing a development in your city, but you're forcing us to build this Riverwalk, so no. And it's public infrastructure, you're gonna own it. It's yours, it's for you. It's not for, you know, our residents or our, you know, shops or anything like that. So you're gonna force us to do this and we're not gonna be able to afford it. And, you know, I think the reality is, I think it's not going to be the final difference maker. I think it's one of many things that are going to happen to help very, very expensive development get over the hurdle. You know, and I think there are maybe similar things that could be considered in other locations, but you know, this is a mandated special piece of infrastructure in a special district that we require. So, you know, I think the value's there, but rather than us bond it and rather than us take on the responsibility, I like the idea of continuing to say, no, it's your responsibility. And over time, you know, if the value's there, then you'll get something back. But you'll get reimbursed for it. And again, we own it, or we have a permanent easement over it, so it remains public infrastructure. But you know, I think insisting upon them working out the financing with a private bank or a private lender, that's also an important piece of this in my mind. You know, is sure, we could put it in our budget, we could build it, we could pay for it, but I think again, it's like sidewalks. I mean, it's the responsibility of the developer. Now this is special and it's different, but it's not that much different that I think we should be footing the bill up front.
it's showing their commitment to develop versus us going in now and spending millions of dollars to build the whole Riverwalk with the hopes that someone would develop. This
Absolutely.
is someone saying, I am coming to develop and can you
Working
help?
it into their plan and their pro forma.
So, I'll give you a scenario. Developer A comes in, needs 150 feet or 200 feet of bulkhead. After 5 years, 3 years, he goes away.
He would have to finish building it before we'll start reimbursing him. So we only reimburse on a finished product. So he'll have to put in the bulkhead and that piece of Riverwalk before.
And then does our commitment end when he leaves?
You mean if he sells the property? That's a good question. Do you know offhand, Mark, if they sell, is it transferable to the next?
My guess is yes, but I'll have to double check.
Okay.
Does it have to be?
I like no.
Okay.
I mean, from
Would something like that have to be?
That's my.
Because they are the ones that actually
Correct.
spent the money,
That's
so
correct.
it would be non-transferable. is
That's
we
what, that's,
prefer. Okay.
so I just think Because otherwise, we're on the hook to the transfer person,
Okay.
and they didn't put the money in.
No, I think that's a very good point. Well,
It's going to be a question that I think is highly relevant to those
Yeah.
doing the development, because, many of them, their intent isn't to own it for the long term. Their intent
Exactly,
is to
that's my
develop and
point.
sell.
If you're going to turn it in 5,
Right. And then there would be the question,
Yeah.
is that good or is that bad for us?
I think we need to know the
Do we
answer,
care?
because it's going to, any smart guy's going to.
Also depends on how it's transferred. So if somebody just sells the LLC that owns the property, technically it's still the same company that owns it, even though somebody different might own the LLC.
Well, I think we need to get Mark to come up with, do his magic and, okay, Mark?
Yes, sir.
Okay. Any other questions? Conceptually, I have no issue with it. I think it's a good deal.
It's good.
Other than that one question, I don't have any others. Do you? Angel, anything?
I don't have any questions right now. I'm digesting it.
Okay,
I mean, it seems like it's a really good idea, but
yep,
I don't
okay,
want to get stuck with stuff.
okay. Good?
very
We're
good. All right,
I
thank
think
you.
I think you can go home
I
now.
think so. Thanks.
Thank you. Ms. Glanz, you're up.
I think we'll probably tag team this one.
Sure.
So as we alluded to earlier, we have been having, for many months, back and forth conversations with the county. This was headed towards arbitration, and we were able to secure a deal before having to do that. This deal agreement that we signed, that was announced today, includes issues of ESG, those payments, the chiller, which has been over our heads for many years, information that Keith found out about an old lagoon at our wastewater treatment plant, which was great. So we were able to balance some of those things to come up with the number that you see in front of you. We, again, tried to include tax billing, and were unsuccessful. Yeah, so the agreement was to pay this all in 1 year. Unfortunately, we tried to spread it out, but we landed in a fair place on most of the things, minus tax billing. So there's a budget amendment before you for $269,000, $526.36. So I know it's hard to digest.
Oh, it's easy to digest.
Yeah, I think
It's hard to do it.
so. Going back to the dynamics when the ESG agreement was undertaken and when the chiller was put in. I have long agreed with what I think was a reasonable discussion of solutions, which included we benefit from the chiller, and that was I think something that we should have at some point agreed to. Now, I think the other thing was process. They simply failed to ask permission, and whoever was in charge at that time, and I actually don't remember, simply failed to go through the process correctly. You can't compel in the state of Maryland a local government to spend money. That's up to you. You have to appropriate those funds. And the process was not followed, which should have gone to the mayor, the city administrator, and the council at the time. Now, we're talking about, 8 years ago, right, or 7 years ago. So, long time ago, but still wrong and mishandled. The sludge handling facility is even older than that, the agreements. And, obviously, again, the county made an agreement and payments weren't made, or not all of the payments were made. And so luckily, that was discovered through this process of looking through old documents, and that was included. You know, ESG, I think there's an argument as to whether or not there was the intent to enter into an agreement there. You know, Mark, I don't know how you'd characterize that component of the agreement.
The issue is this, that the county was pushing forward with this ESG agreement. City officials were aware of it, and there was this sort of unwritten agreement that that the city would contribute. But they never went back to the city and went through the formal processes or anything else, so.
I mean, again, it all comes down to process. You can have all the intent in the world, but if it didn't come before a council as a resolution and signed by the mayor, intent means nothing, because you didn't get the formal body to make that decision.
Correct. And now the formal body did approve a management agreement.
Yeah.
And see, their argument was, well, based on this management agreement, you should contribute these expenses. And no one followed through with the proper process, and again, in the management agreement. I think that the real issue is that we were asking for the equitable conveyance of half of this building to the city of Salisbury. And the problem is, these were all equitable defenses that the county was raising to that. So I think in the end, it was the conclusion that if to get half of this $4.5 or $5 million building, we were not going to get what we wanted unless we were willing to at least make some equitable contribution to the building. And so this really represents half of the chiller, but it represents substantially less than half of the ESG payments. So there is a substantial savings there.
So, reading this, since it was an arbitration, correct?
Yes.
We have no say in it.
You must budget the funds in order for this thing to go through. And
This year.
For the chiller. And then I think 1 year of contributions to the ESG. That's what's included in the figure that you've been presented with. And then each year, there'll be an additional contribution, I think of about $17,000 per year.
That's right.
Until that.
$7,051.
Right. And in the interim, the county will convey 50% of this building to the city.
Have they
And that's
conveyed it?
gonna
Have
take
they
place.
conveyed it yet?
No, but in other words,
They have
once these
60
funds
days.
are budgeted and committed, they will convey it, yes. That's all.
But they're
How
required,
about,
they're
how
required
about
to.
we,
By our settlement agreement. I don't know that, do you actually have the?
Yeah,
Yes,
and it's,
yeah.
it
Yeah, we
says
got it.
The settlement agreement
60 days.
requires that they will do it within so many days.
Yeah.
And
60
there
days.
has been a delay, really, of that process because there was a plat done that for the conveyance. And apparently the original plat was lost by the county, literally. I think that's what happened. But that's been replaced and is to be signed. But at some point in the executive offices, that plat disappeared. So,
Yeah, it says Wacomico and Salisbury agree to execute and record a plat of the government office building within 60 days from the date of the settlement.
and that plat is finished. That's the one that went missing after it was signed. And then the deed as well.
You know, and, while there is one outcome is that, we end up with something worth almost $3 million and, we have to pay, a couple $100,000 for it. And I think we owed part of that, and I think they owed us, and, those are fair things. Let's all remember, we offered better terms than this 8 or 10 months ago, and instead, a lawsuit was filed. So it's really just kind of sad. But the other thing that I'd say is looking at looking at the tax billing piece of this, you know, that was totally unfortunate, disconnected in any way from any of this, and just really an attempt to extract one thing out of the city. And all it does is hurt our taxpayers, you know, who, by the way, pay taxes, city,
So-
county, state.
Yeah.
It's just unfortunate.
Just a theoretical. Supposing we don't approve this until the new year.
Well, technically, we would be in breach of the agreement.
And then what does that expose us to?
To going back and arbitrating.
Starting over again?
We would have to start over again.
Okay.
Ouch.
Okay. I'll go ahead.
Did I miss something?
No. Trust me, you didn't miss anything.
Oh, okay.
Just Jack, a little heartburn, that's all.
Oh, okay.
I'm looking forward to the next couple of years. We have consensus? Okay, yeah.
What option are we left with?
Yeah, we have no option, but we will someday. We will have our option someday.
Absolutely.
I told you this
Someday
would be
soon.
the council chamber.
Okay. Any thing for the good of the order? Hearing none, we are adjourned. Thank you, everyone.
Thank you. My back.